Tonight's example of Fox News tactics was on World News Tonight with Charles Gibson. Worsts ahead on Countdown. Calling Senator Grassley's line about the Titanic. You're right, Senator. The Titanic analogy works as long as it's a metaphor not for Medicare, but for the health care system as a whole. We should be not putting Grandma or anybody else on that sinking ship. And we have, again, the field trip senators might take, not because it would be smart politics, but because they might actually learn something, even those who think they know about compassion and other people's pain. In our fourth story on the Countdown, the free health clinic in Kansas City happening now. The third free health clinic made possible by your donations to the National Association of Free Clinics. The Kansas City Convention Center opened its doors today at noon. Nearly 1,000 people have come through so far, and these volunteer medical services will be provided again tomorrow in this two-day event beginning at 10 a.m. prevailing local time. The clinic will also be streamed live to the Countdown website tomorrow between noon and 6 Eastern. And joining me now from Kansas City, the Executive Director of the National Association of Free Clinics, Nicole Lamoureux. Nicole, good evening.
Hi, thank you for having me.
How has today's event progressed? What are you seeing today in Kansas City?
Well, it's been a very busy day here in Kansas City. They had their first winter weather, and despite that, we've had an overwhelming number of patients and volunteers show up for today's clinic.
Are there any recurrent themes as compared to what we've seen in New Orleans and Little Rock, and are there notable differences? Compare these events.
Sure, Keith, as we've talked about before, the amazing support from the safety net providers, the free clinics, and the volunteers in this area is exactly the same from wherever city we go. And the patient's gratitude and need is here as well. Some of the differences we have seen at this clinic has been the expansion of services that we've been able to offer, such as dental care and expanded mental health care as well.
If you didn't know what this was for, if this were if this were a convention of some sort, you wouldn't be able to tell this from the lines of people coming in. There's nothing that says to you, oh, these people are downtrodden or things are unavailable to them. These are people. These might as well just be people you've selected randomly off the street. Aren't you struck by that each time you go to one of these things?
Every single time I come to the clinic, I hear a story from a volunteer, and one struck me today. A woman came up to me and hugged me and said, "Thank you so much for letting me volunteer here today, because I am pushing a woman around in a wheelchair, and she's my neighbor, and I had no idea that she was uninsured and in such a place." So I am always struck by stories like that. As we've talked about, 83% of our patients are working, and they look exactly like everyone else. There is no way to tell that they are uninsured.
Yeah, I mean, other than the coats for the volunteers, you can't tell the difference between the volunteers and the people who are getting the help. But as the leader of this group, of this effort, you have made this about care for people who truly and obviously sometimes desperately need it. And we don't check anybody's card on the way in. You come in, you need the help, that's about it. But the reality obviously is there is an intersection with policy. There is an intersection with people in Washington who think they know of what they speak. What simple item would you have them include in this health care bill? Step outside of politics and show the politics a little real life.
Well, I don't think it is a simple answer, because I don't think you can put into words that these people, the people that have to line up at 10 a.m. at 2 degrees, they need help. I don't know how you put in legislation the face of the uninsured or the people who are here. The only thing I can say is that I would encourage every member of Congress to come to one of these free clinics or go to visit their local free clinic so they can see what is going on. But if I had to put some pieces in the legislation, I would say accessibility, affordability, portability, and access to quality and easily affordable prescription medications.
That would be an extraordinary start. I don't know if we're going to get it or not. But in the interim, Nicole Lamoureux, Executive Director of the National Association of Free Clinics, again, we thank you. You're doing as much as anybody in this country right now on this issue. Thanks, Nicole.
Thank you.